Tetracycline, a type of antibiotic, a group of medication, group of antibiotic belong to the protein synthesis inhibitor. In this slide or in this maybe picture here, we are going to speak about the clinical use and what bacteria will be covered with the treatment with the tetracycline. Number one, we have acne. The bacteria cause acne, Propionibacterium acnes. And tetracycline used to treat cholera and used for Febrio cholera. Tetracycline used for Rocky Mountain spotted fever, and this is caused by microbial called Rickettsia. Then we have sexual transmitted infection, sexual transmitted disease caused by chlamydia. We have several types of bacteria, microbes may cause sexual transmitted disease, such as syphilis, such as gonorrhea, such as the main things here. Tetracycline will be cover chlamydia. Chlamydia cause sexual transmitted infection. We use tetracycline to treat pneumonia, but we have to be very specific here. What type of pneumonia? Is the gram negative, gram positive? Do you have a specific type of pneumonia here? Okay. So they said mostly for atypical pathogens, atypical microbial. For atypical microbial, we have Mycoplasma pneumonia. We use the tetracycline for the chlamydia pneumonia. And we use for tetracycline for another type that cause a Q fever called Coxiella burnetii or burnetted. Tetracycline could be used for the treatment of peptic ulcer disease as a protocol of treatment. It's not alone. No, we don't use tetracyclines, for example, for the treatment of peptic ulcer alone, but we use tetracycline as a protocol of therapy, like a triple therapy or quadruple therapy of treatment peptic ulcer disease. And because we know that tetracycline considered like effective medication to treat Helicobacter pylori. Leptospirosis, tetracycline could be used for leptospirosis that caused by leptospiria. We use tetracycline to treat Lyme disease, and we use it for brucellosis, Lyme disease, brucellosis, and both of them caused by microbes called Borrelia. Tetracycline could be used for Legionnaires disease that caused by Legionella pneumophilia. Okay, continue speaking about tetracycline. We are going to speak briefly here as a summary synopsis about adverse drug reaction, warning, precaution, spectrum, mechanism of action. Okay, regarding adverse drug reaction, tetracycline may cause photosensitivity and may cause sunburn. Therefore, we recommend patients to avoid exposure to the sun. Tetracycline may cause tooth discoloration and enamel hyperplasia. Tetracycline causes retardation of bone growth. Tetracycline may cause hepatotoxicity, especially when you use it with a high dose during pregnancy. Tetracycline cause renal toxicity, especially when you use expired medication belong to tetracycline. So if you have tetracycline and it's already expired, we recommend to stop using tetracycline because it's carry the risk of renal toxicity. Okay, specific type of monocycline, they found that associated with a vestibular toxicity is a monocycline. So we have vestibular toxicity here. The patient may suffer from imbalance, dizziness, vertigo due to the treatment with the minocycline. Regarding the spectrum, tetracyclines in general considered broad spectrum antibiotic, cover gram-positive bacteria, cover gram-negative bacteria, cover atypical pathogens in addition to the other bacteria such as Borrelia and other. How the tetracycline work. The tetracycline inhibit bacterial protein synthesis, binding to the 30S ribosome subunit. Tetracycline binding to the 30S ribosome subunit prevent attached amino acid transfer RNA to the ribosome, and this will lead to the bacteriostatic action. So tetracycline considered like bacteriostatic antimicrobial. Another important issue should be taken into consideration when you use tetracycline, because tetracycline considered like broad spectrum antibiotic. Tetracyclines may cause superinfection. What that mean for us? Tetracycline may cause oral thrush. Tetracycline may cause Pseudomonas colitis. Tetracycline may cause vaginitis. Okay, so regarding the tetracycline mechanism of action, first of all, we need to look what we have here. As you can see here, we have amino acid transferase. We have amino acid transferase here. Try to bind to the messenger RNA. So we have transfer RNA try to bind to the messenger mRNA. And we have two subunit here, two subunit ribosome, 50S subunit ribosome and 30S subunit ribosome. And in this table here, or this list here, they try to remind us with what medication we have belong to the tetracycline. Again, we have tetracycline, monocycline, doxycycline, demoxycycline, and the brand name for doxycycline, fibromycin, for monocycline, monosin, for example, here. And now we look on how the protein synthesis work. As you can see here, amino acid transfer RNA try to bind to the 50S subunit and try to work on the 30S subunit and synthesize the protein through the messenger RNA. So under the effect, when we prescribe tetracycline to our patient, what happened there? And you can see here, we have the mechanism of action for tetracycline. They said tetracycline binds to the reversibly to the 30S subunit of the bacterial ribosome. So the main mechanism of action, tetracycline bind reversibly to the 30S subunit of the bacterial ribosome. What happened next? This is the first step. The second step, you can see here, by binding, this will lead to the blocking access of amino transferase RNA to the messenger ribosome RNA complex. So you can see here tetracycline, from the image here, tetracycline block the access of amino acid transferase to the messenger transferase, and this will lead to the inhibit protein synthesis. So this explains how the tetracycline work by blocking access of transfer RNA to the messenger RNA by binding to the 30S ribosome subunit. In this slide and the next coming slide, we are going to speak a little bit about distribution of tetracyclines in general. As you can see here in the slide, they said tetracycline not fully absorbed from the oral. So when you prescribe it orally, it's not fully absorbed, specifically when you talk about tetracycline. But they found doxycycline and monocycline almost completely absorbed. So what we have here, you can see the most maybe appropriate for the oral administration will be doxycycline, monocycline, because this medication almost completely absorbed after oral administration. On the other hand, for example, tetracycline alone is not completed absorbed from the oral system. We have another group, doxycycline also available like injectable, could be for the treatment of severe infection or like chronic infection need rapid action of antibiotic such as doxycycline. I'm going to share some picture from the Google image with you about this group of medication. Okay, this image here present the tetracycline as maybe capsules, and you can see here tetracycline capsule. Important, nice image here to see the tooth hyperplasia, and the tetracycline precipitate in the teeth and cause tooth hyperplasia. Available as a capsule. If you click on this one here, for example, if I click on this image, you can see the tetracycline here. Moving to the doxycycline, and doxycycline here, if you scroll up a little bit, only to show you doxycycline available as injection and available as capsules. You can see it here like doxycycline, like ampule here, and injection is available in both. And if you scroll down, if you close this one and scroll a little bit down to see if anything important, I will remove doxycycline as injection here and make it like only doxycycline. Okay, so you can see here do we have doxycycline, and they show us some picture for the acne. So we use this doxycycline for the acne, for example. Again, we use it for the acne, some picture for the acnes. Moving to the minocycline, you can see the minocycline here. If you click on the picture, they show you the monocycline, and they show you some picture for the minocycline here for the patients maybe suffer from acne. Demoxycycline, the treatment for demoxycycline, if we press on one of these medication, demoxycycline, we have it here, for example, demoxycycline tablets available. Also, if you scroll down, we have some more information about demoxycycline hydrochloride as a possible treatment for the another type of disease, not acne, not for example other cases, very specific case to use demoxycycline. I'm going to discuss that later on with you. Okay, so again from this slide, we need to emphasize the tetracycline not completely absorbed, number one. And number two, doxycycline, monocycline almost completely absorbed after oral administration. And number three, we have doxycycline available like injectable formulation to treat some type of infections. Okay, speaking about food, can we take tetracycline with food? Do we have any restriction to inform your patient not to take a certain food with the tetracycline? What they said there, they said any dairy product, for example, such as milk or like calcium ions, any maybe products rich with the calcium, such as milk or any other product available with that rich with calcium or ions. This group of medication, ions and calciums, this make bind to the tetracycline and cause chelating agent and prevent absorption of tetracycline. Therefore, we don't recommend, for example, to use the calcium or the ions, as you can see, or antacid with the tetracycline, because this medication bind with the tetracycline, forming the chelating agent and prevent absorption of tetracycline from the GI system. So in this case, we recommend to take it on an empty stomach with a full glass of water there. Again, another important issue about tetracycline, as you can see here, they say tetracycline accumulate in the liver, in the kidney, in the spleen, in the skin. So the accumulation here is very important issue here. If you talk about skin, therefore tetracycline considered like benefit treatment for the acne, because tetracycline arrive to the skin with a high concentration, accumulate in the skin, accumulate in the kidney, in the liver. What else? So they found also tetracycline bind to the tissues and cells, especially when you talk about calcified tissues, for example, such as teeth and bones. So the tetracycline bind to the teeth and bones, and sometimes bind with the tumor that has a high level of calcium, such as gastric carcinoma. So tetracycline binding to the teeth and bone, binding to the calcified tissues. This would take consideration when you prescribe it to the children less than 8 years of age. When you prescribe it to the children less than 8 years of age. Okay, again for the important issue here, body fluid penetration. They said generally tetracycline penetrate, able to penetrate tissues and cells. So tetracycline arrive to the tissue and cells such as teeth, bones, kidney, skin. Tetracycline arrive to these tissue. However, arriving to the cerebrospinal fluid is not adequate. Penetration there is not like insufficient. What that mean? It's not ideal treatment. So because not ideal treatment for meningitis, we don't use tetracycline for meningitis because tetracycline unable to arrive with enough concentration to kill the bacteria to the brain. So the tetracycline unable to penetrate the to blood-brain barrier arrive to the brain with enough concentration to treat and kill the bacteria. One exception there, not all tetracycline. They try to remind us here we have the monocycline. Monocycline able to arrive to the brain with a sufficient concentration. So if you remember, we have tetracycline, doxycycline, monocycline, demoxycycline. They said monocycline able to arrive to the brain with the concentration, and the other tetracycline unable to arrive to the brain with enough concentration. An important, very important maybe consideration during practice. It's not allowed to prescribe tetracycline to the pregnant woman because tetracycline cross placenta barrier and concentrated in the fetal bones and fetal teeth. So we are going to speak what is the consequences when tetracycline bind to the fetal bones and fetal teeth. So therefore we don't use it during pregnancy. Okay, so it's not allowed to use tetracycline during pregnancy. Okay. Okay, regarding the clinical use of tetracycline, as you can see here, we have list of disease could be treated with the tetracycline: recticial diseases, mycoplasma pneumonia, chlamydia infections, uncomplicated gonorrhea, brucellosis, plague, cholera, urinary tract infection. Here it depends on the culture and sensitivity. We use it for acne. We need to put like 4+ for acne. Pelvic inflammatory bowel disease. Monocycline is preferred for the treatment of meningococcal carriers. Demoxycycline is used for the treatment of tumor secreted ADH. So you can see here the last one here in the group. I will maybe highlight it here. You can see it here. We used demoxycycline. We use demoxycycline for the treatment of ADH secreted tumor. Monocycline, we use it for the patient suffer from, for example, with a monococcal bacterial carrier, pelvic inflammatory disease, acne. We use I prefer to put 4+ for acne. Is a very important group of medication. Cholera, 4+ for cholera. Okay, so black or black for use for 4+ for the brucellosis. Also we use it. Chlamydia infections. Please remember all these maybe clinical disease that can be treated by the tetracycline. Again, this slide here to show you what we have regarding the tetracycline. Tetracycline used for the treatment of acne. Tetracycline used to treat of cholera. Tetracycline we use it for treatment of Rocky Mountain spotted fever. Tetracycline used to treat the sexual transmitted disease, especially with a specific type of infections. Chlamydia, for example, pneumonia with the typical microorganism. We can use a tetracycline also for the treatment of peptic ulcer disease as a part of protocol to eradicate Helicobacter pylori. Tetracycline could be used for leptospirosis and for brucellosis, Lyme disease. So all these consider like clinical use of tetracycline: acne, cholera, Rocky Mountain spotted fever, sexual transmitted infection, pneumonia, peptic ulcer, leptospirosis, Lyme disease. Therefore, we consider tetracycline broad spectrum antibiotic. Okay, this slide here demonstrates the dosage and route of administration of tetracycline. As you can see here, we have tetracycline as a maybe as a medication capsules available. We can prescribe it 1 to 2 gram orally. So in this case, we have 500 milligram, prescribe it 2 times to 4 times per day. So you can see here 4 times tetracycline, short half-life. We need to prescribe it 4 times per day. Followed by doxycycline monotherapy. It's like long effect medication. We prescribe it once daily, available 100 milligram, 200 milligram. This medication prescribable orally. Also, as you can remember, doxycycline available as an injectable medication. We remember that. Then we move to the demoxycycline. It's like 600 milligram orally. Monocycline 200 milligram once daily, or orally and IV available. Oxytetracycline, this is 1 to 2 gram per day, and then we have 1000 milligram IM. We have 1000 milligram IV. So all these preparation available for the clinical practice. Please remember, tetracycline we need to prescribe it 4 times daily to cover the antibacterial, to cover and kill the bacteria, or inhibit growth of bacteria. Doxycycline, monocycline, oxytetracycline, it's like once daily. Okay, speaking about tetracyclines, adverse drug reaction, or we call this one unwanted effect of tetracycline. Patient may suffer from gastric discomfort, effect on calcified tissues. We already discussed that. Fatal hepatotoxicity, phototoxicity, vestibular problem, pseudo tumor cerebri, and then super infection. All these considered like important in the practice. We need to take this in consideration, educate the patient about all these possible side effects that might happen during treatment. Okay, some explanation about the adverse effect of tetracycline. As you can see here, the tetracycline affected carry the effect on the bone, on the calcified tissues. So you can see here the tetracycline deposition in the bone and the primary teeth, and this affect the growing children and may cause discoloration of and hyperplasia of teeth. So two things here may cause may affect the calcification of growing children and cause retard the growing bone. Number one. Number two, may cause discoloration and hypoplasia of teeth. Therefore, it's very important to not prescribe this medication to children less than 8 years old. Okay. Photosensitivity, patient may suffer from sunburn due to the exposed to the sun, and therefore we recommend patient not to expose to the sun or ultraviolet rays. This medication may cause vestibular problems such as dizziness, nausea, vomiting, especially with the monocycline and the doxycycline. This medication may cause something similar to the tumor in the brain, but this is not tumor. This is pseudotumor cerebri, and this is related to the increased intraocular pressure. So the reason for patients suffer from symptoms similar to the tumor, because tetracycline increase intracranial pressure, and this increase to consider like benign intracranial hypertension. Moving to the last one here, super infection. This is very important because if you remember, if you go back to the broad spectrum, and we said that tetracycline considered like a broad spectrum antibiotic. Therefore, tetracycline inhibit the flora, and this will lead to the overgrowth of candida, overgrowth of staphylococci, and this medication may cause pseudomonas colitis due to the Clostridium difficile overgrowth. Okay, by continuing to speak about tetracyclines here, we need to cover the contraindication of tetracycline. When we saying the contraindication, that means it's not allowed to prescribe tetracycline to this patient. For example, if the patient suffers from renal impairment, and depends on the what type of renal failure do you have, like stage 1, stage 2, or like end stage renal disease, they said we don't recommend to use tetracyclines in general in patients with renal impairment. we have some exception there. They said except doxycycline. So doxycycline, we can prescribe doxycycline to the patients suffer from renal impairment or renal failure. The other tetracycline is not recommended because other tetracycline will be accumulate in the kidneys and aggravate the pre-existing azotemia, and this will lead to the aggravate renal disease. Okay, so please remember from this slide here, the question now, which of the following tetracycline allowed to prescribe to the patients suffer from renal failure? So tetracycline considered like safe medication in patients suffer from renal failure. So you have, for example, patients suffer, come to the clinic, suffer from acne, but this patient suffer from renal failure, and we have list of tetracycline. Which medication we are going to prescribe? Doxycycline will be the drug of choice for the situation here. Okay, very important thing we need to emphasize here, tetracycline is not allowed to prescribe during pregnancy. Tetracycline is not allowed to prescribe during pregnancy or during breastfeeding due to the potential harm to the fetus or infants. So for this reason here, it's not allowed, contraindicated, tetracycline. The same apply for aminoglycoside. The same apply for fluoroquinolone. So 3 group medication, we don't recommend to use it. Tetracycline, aminoglycoside, and fluoroquinolone during pregnancy. Moving to the children, children less than 8 years of age should not be using the tetracycline due to the risk of permanent risk discoloration and discoloration of teeth and hypoplasia of teeth. So this will be present the case when you have patient, for example, possible of getting pregnant or during lactation, or children less than 8 years of age. All these group like consider like contraindicated, contraindicated and not allowed to prescribe it to them. Pregnant women during lactation and children less than 3 years of age. Okay, this will conclude our session for today. Thank you so much for your watching and have a great day.